My name is Shakaya, and I'm just here to do my head to toe assessment on my patient. I do have my stethoscope. I do have my pen light, which is here. I've got my pen light. I also have my watch that I have on that is a second hand, and I also have my hand sanitizer. So the video is gonna be a little bit choppy because I'm filming on my cell phone with my patient, but at the end it will, be all together. Okay, thanks.
Okay, so I would obviously come into the room, wash my hands, obviously. Hi, how you doing? My name is Shakaya.
How you doing?
Hi, and can you tell me your first and last name, please?
Michael Johnson.
Okay, and I just want to look at your wristband, Michael Johnson, and your date of birth.
Is 2/21/86.
Okay, and then I would obviously look at my documents to make sure that the two identifiers are there. I have already closed the curtain for privacy, and as you see, I did wash my hands. And I'm also going to be moving the camera around a little bit. So, Mr. Johnson, do you have any allergies or anything?
To dogs.
You're allergic to dogs? Okay, are you having any types of pain or anything like that? Is anything bothering you?
No.
Nothing? Okay. So at this point, I would take Mr. Johnson's vital signs. I will put that in a document at the end, and all his vitals are stable, and he's doing good. Mr. Johnson, do you have any wounds or anything on your body? Are you okay?
Yeah, I'm all right.
You're okay? No injuries or anything recently that you'd want to tell me about?
No.
So I'm just going to do a head-to-toe assessment on you. Let me know if you feel uncomfortable at all at any point. I'm just wearing this mask, obviously, because of Corona and to keep the both of us safe. So I'm just going to be starting a head-to-toe assessment on you. The first thing I'm going to be doing is starting with your head, and then I'm going to be moving down your body. Is that okay?
Yes.
So you consent to the head-to-toe. It's okay?
Yes.
Okay, good. I notice nothing in your head. There's no lumps. Take a peek in your ear. Is it okay if I take your iPod out?
Yes.
Thank you. Okay. Nothing in the ear. And just look at me in my eyes. Okay? So both of your pupils are equal and reactive to light. Are there any pain here when I press here?
No.
Nothing? Okay. Very good. What about any pressure here? Anything abnormal? Feeling any pain or anything?
No.
Feeling good? Okay. So as I stated before briefly, his eyes are equal and reactive to light and accommodation. There's no issues there. Mr. Johnson, is it okay if I take a peek inside of your mouth? I just want to make sure everything looks good.
Yes.
Okay, I'm just going to remove your mask and I will help you put it back on. Can you open your mouth for me? Can you lift your tongue? Open your mouth and say ah. Oh, I can do that, Mr. Johnson. It's okay. All right. Any issues with the nose or anything?
No.
Nothing? Okay. Very good. Mr. Johnson, do you know where you are?
In the doctor's office.
Yep, and can you tell me today's date and the year?
2000. Oh, sorry. January 21st, 2022.
Excellent. Thank you so much. Okay, so Mr. Johnson, I'm going to now start to assess your lower part of your body. I have already assessed his oral cavity. I think I said it, that his mouth, his mucous membranes are moist. His teeth look fine. I didn't find any findings inside his mouth that's indicative of any type of illness going on. His lips were pink, so the oral cavity looked very good. Okay, I'm just going to put my pen light down. Can you take my hands and grip them at the same time? Very good. Okay, all right, thank you. And then checking capillary refill. Yep, it is at 3 seconds, which is good. Any feeling of swollenness or pain when I'm touching you this way?
No.
No pain or anything? Okay. Your skin is warm to the touch. I don't feel any type of edema or anything. So that's good in that area. Okay, Mr. Johnson, I'm just going to palpate your pulses. Both very strong. Want to palpate bilaterally. Very strong. And I'm going to put my hands here, and I need you to lift up against my hands, okay?
Okay.
On the count of 3. And you can lift. Just lift, put a little bit of strength. Very good. Excellent. Can you go like this and move your arms for me up and down? I'm just checking your range of motion. Can you abduct and adduct for me? Excellent. Very, very good. Okay, can you close your eyes for me for 1 second? Can you tell me where I'm touching you?
My wrist.
Excellent. Very good. Okay, so now I'm going to locate your apical pulse at the mid-clavicular line at the 5th intercostal space. I am going to listen to your pulse for a whole full minute. Is that okay?
Yes.
I just want to make sure through this whole experience that my patient is comfortable. Any minute that you don't feel comfortable, just let me know, okay?
Okay.
Okay, so your pulse is strong and steady, and he is at 71 beats per minute, so that's really, really good. Okay, so I'm going to assess your lung sounds right now. The reason that I had you sit up is because I'm going to assess your lung sounds in the front and the back, and it may be a little bit more comfortable for you, and it will be better for me to hear if you're sitting up that way. So the only thing I need you to do is just scoot forward just a little bit. Thank you. Just breathe normally. Now I'm also going to be doing the same thing from behind, and I'm going to stop the assessment briefly before continuing. The reason I'm doing this is because I want to hear lung sounds in the front and the back, and I'm going to go all the way down the back in this order. Okay, just breathe normally, Mr. Johnson. So lung sounds are clear to all lobes, bilaterally, anterior, and posterior. I didn't hear anything abnormal. Are you having any difficulty breathing or anything? You feel pretty good?
Because I got the mask on. That's it.
Oh, so the mass is a little bit, depleting. I know. I'm sorry about that. Okay. Okay. Now I'm going to be assessing your bowel sounds. I just want to make sure there's nothing going on here within your stomach area. Is that okay?
Yeah.
Okay. Can you just put your hands to your sides for me? Thank you. I'm just assessing bowel sounds in all 4 quadrants. Bowel sounds are definitely hyperactive. Mr. Johnson, you did just eat. Did you tell me that you just ate a little while ago? Okay, so that makes sense.
What, you hear noises or something?
Yeah, I can hear everything that's happening in your stomach. Any pain when I palpate? Anything feeling weird? Any type of pressure points? Anything?
No.
Stomach symmetry is equal. Do you mind if I take a peek and look at your stomach?
Yeah, sure.
Okay. And obviously doing this, I would have gloves on. I see no signs of injury, no darkened areas that could be indicative of a hematoma of any sort. The stomach feels good. Don't want to press too hard because I know that you just ate.
Yeah, thank you.
Okay, so what I did was I did move the camera back. I'm going to be assessing his lower extremities now. So this is why I have the camera aimed at his lower extremities. Because I want to make sure you guys can see everything that I'm doing. And for the record, Mr. Johnson did not feel comfortable removing his pants. So I will assess the skin and everything best that I can. He is okay with me lifting his pant leg. Okay, Mr. Johnson. So I'm just going to be assessing your legs. I just need to know, do you have any issues in the perineal area here? Are you having any issues going to the bathroom?
No.
Do you go to the bathroom, frequently enough?
Yes. Yep.
There's nothing that you think that I should need to know about, that you notice anything that's weird in the frequency that you go to the restroom or anything?
No, it's regular urination.
Okay.
And bowel movements.
Okay, perfect. Just going to get down here, and I am going to just assess your skin. The color looks good. The temperature looks good. No signs of edema, no pitting whatsoever. It is warm to the touch. Do you have any recent injuries? Did you hit yourself or in any pain? Nothing?
No.
Okay, very good. No types of ankle swelling at all. And I'm just going to remove your sock just to check your capillary refill.
Yep.
Now, again, when I do this, I would obviously have gloves on. Very good. Very good. Good. Okay, no issues with that. So there is a little test that I would like to do just to test the strength in your legs. I'm going to, the same thing I did with your upper extremities.
Yep.
When I put my hands here, just push up against my hands, okay? Very good. Nice and strong. That's excellent. Hey, Mr. Johnson, can you do me a favor and just lift your legs a little bit? I'm just testing your range of motion. Can you bend your knee in for me? Perfect. And the other one? That's perfect. Now I'm just going to assess your pedal pulses. Nice and strong. And here, I will see. Let's see if I can get your pants leg up just a bit. Oh, perfect. So this way I can check his tibial pulse. Perfect. Thank you so much for your help, sir. Excellent. Yeah, I felt it more on that side. Very good. Okay. Okay, Mr. Johnson. Now we're almost done with your lower extremity, and then I have just a couple of questions to ask you. I'm not 100% done with this assessment, but I just need you to close your eyes, and I'm going to touch somewhere on you, and you're not going to know which leg or which foot or wherever it's going to be, but I just need you to tell me the area that I'm touching, okay?
Okay. My almost the bottom of my toe.
The bottom of your toe?
I mean, where my toe is attached to my foot.
Right. And one other time, keep your legs closed. Keep your eyes closed.
My leg above my ankle.
Correct.
Right leg.
Very good. Very good. Okay. So I am just doing hand hygiene. I got some hand sanitizer on my hands. All right, Mr. Johnson, we are almost done. I just want to touch and palpate and listen to your carotid artery. It is in your neck. Let's feel them bilaterally. You got some strong pulses.
What does that mean?
Okay. And are you okay sitting like this, sir?
Yes.
Okay. And I just want to take a look at your back quick. Just look at your skin quickly.
Yep.
Skin looks clear. No signs of injury. No hematomas of any kind. Do you have any issues with your back? Are you itchy at all or anything like that? You have any back problems?
No.
No? Have you ever hurt or injured your back at all?
No.
Okay. All right. Very good. Okay, Mr. Johnson, I do just have a couple of questions that I wanted to ask you. So do you have any issues with bowel movements or anything? Do you go at least once a day?
Yes.
Okay. Do you have any issues with appetite, or do you have any eating problems? Are you vomiting at all after you eat or anything like that?
No, I just I eat after 12 o'clock.
Mm-hmm.
Normally I take like a protein shake for breakfast.
Oh, that's good. Okay, so no weight issues, any gastrointestinal issues?
No.
Nothing like that. Do you ever get stiff in your hands or think that you may possibly have arthritis? Are you familiar with what arthritis is?
I heard about it, but no, I think everything's good.
But no stiffness, no crackling, no crunching or anything
No.
in your hands? Okay. And do you have any other questions for me?
No,
So how can you tell me a little bit about your diet? What foods do you enjoy eating?
I'm a vegetarian, so mostly vegetables or plant-based things or meat substitutes,
Okay.
veggie burgers and such.
So you don't eat meat. How long have you been a vegetarian for?
Since '95.
Oh, no, okay. Do you exercise frequently?
Not really.
No?
No.
Okay. So, just to give you some patient teaching, you're in pretty great shape. I must say, you're in pretty good shape. Do you have any breathing difficulties at nighttime, or, do you lay a certain position and you have trouble breathing at all?
Well, I have a sleep apnea machine, but
Okay.
that pretty much helps me breathe good.
Oh, sleep. Okay, and you wear that every night, right?
CPAP, yep.
Okay, and you have a doctor that monitors that, your readings?
Yes, they every once a year I go in for readings.
Oh, okay, excellent. So, other than that, based on your age and everything, your assessment was really good. Just to give you some patient teaching, I would recommend you trying to engage in more physical activity.
Okay.
The older we get, things start to slow down and everything, and we don't want you to run into any health problems because you're in pretty great shape. So
Thank you.
I am going to be giving you a pamphlet.
Okay.
If you have any questions, feel free to give me a call. The pamphlet has some resources in there about diet, about different exercises you can do. But again, if you have any questions, feel free to give me a call, okay?
All right, thank you.
All right, thank you so much.
No
It was
problem.
nice meeting you.
Have a good day.
You too.